My name is Arif Kamal. I'm a medical oncologist and palliative care physician at Duke. I work with a research team developing what we call the QDACT, or Quality Data Collection Tool. We do a lot of health services research, especially around health information technology, both in palliative care and supportive oncology. In 2007, Duke University entered into a very novel relationship with 4 other community palliative care organizations. The group came together and called itself the Carolinas Consortium for Palliative Care. In 2007, we started with a paper-based form because we wanted to understand what type of care people are delivering in the community. That paper-based form eventually evolved into what we use now as QDACT, which is an online electronic platform. What happens is clinicians, as they're seeing patients, use our iPad tool while talking to the patients to understand what needs they have, as well as using some amount of decision support to help them understand how they can be caring for those patients in a better way.
Let's talk about 10 years ago in my melanoma practice, right? So perhaps I wanted to know how good of a job I am doing in making systematic decisions for the management of a person with metastatic melanoma. I would need to go and pull some charts, fill out a form, often amass the data using Excel, perhaps. So in fact, it was a whole bunch of arduous steps. Maybe we get to the point of a database, but the database is an old story. And so the closest I can do in terms of my quality improvement activities is make decisions based on the 6-month-old or older story.
What we're able to do is essentially template out what a palliative care clinical encounter should look like, all the way from physical symptoms through end-of-life care, emotional support, psychosocial support, and even evaluation of performance status.
So that we're doing 2 things at once. One is we're answering, what's the current state of quality and monitoring it for the future. And the other is that we are carefully populating a large database that aligns with lots of other data needs, so that that data set then can be repurposed for lots of other things. Research, it can be repurposed to identify gaps in care that need new evidence, etc.
So what's innovative about QDACT is we're actually bringing that capability to point of care, meaning that you learn as you're doing documentation within the electronic medical record how you're doing as well on several different quality measures. You get immediate feedback, and ultimately and most importantly, you can affect the care of the patient you're seeing that day in a real-time way. We wanted to make sure that it's something that's usable and is most importantly helpful for clinicians no matter where they are and no matter what type of patients they're seeing. Because ultimately all clinicians want to do better, they want to participate in process improvement, but they want to do it in a way that's not 6 months looking in arrears, but it's actually happening at the time that they can affect how the patient will do.